Namaste. I, JVN Dr. Shaima Kadri from Faculty of Physiotherapy and Diagnostics. And today in this video, we are going to talk about fracture of the shaft of the humerus. So first, we discussed about the fracture of shaft of humerus. You all should know about what is fracture, as we discussed all about before about general fracture. Let me continue with the our today's topic. But the thing is that what is fracture if are talking about the fracture is the breakdown in the continuity of the bone, right? So if here we are going to talk about shaft of humerus fracture, that means that clearly denotes as name denotes that the fracture may occur in the shaft of the humerus. That means the breakdown which where occurs at the area of the shaft of humerus, means we can easily say that the breakdown in the continuity of the shaft of the humerus. So now let's continue with the topic of humeral shaft fracture. Humeral shaft fractures are common injuries. Like any orthopedic injuries, they have a bimodal distribution occurring in both younger and elder patient due to high energy trauma and in elderly patient following low impact injury due to the location of the radial nerve within the spiral groove. There is a reasonably high risk of injury. The overall incidence is around 10%, although this is much higher, approx 25% in hostilin levis fracture. The risk factor for the humeral shaft fractures include osteoporosis, increasing age, or previous fractures. Humeral shaft fracture can also occur as pathological fractures. So, if we talk about the normal anatomy of humerus, we have anatomical neck, greater tuberosity, surgical neck, humeral head, intertubular groove, laser tuberosity, deltoid tuberosity. If we see on the posterior and anteriorly different views. So now, what are the clinical features of shaft of humerus fracture? So there is pain and deformity are the predominant features of the injury. These fracture may occur from a fall directly onto outstretched limb or falling laterally onto the abducted limb. If the radial nerve is involved, the patient may also complain of reduced sensation over the dorsal first wave space and weakness in wrist extension. On examination, ensure you are carefully check the document and neurovascular status. Assess of open wounds and any suspected co-occurrent injury or fracture, particularly if there was a high energy impact involved. So, as above, we talk about the Holstein Lewis fracture. You should know that what is the Holstein Lewis fracture. It is a fracture of distal third of the humerus resulting in the entrapment of the radial nerve. The resultant neuropraxia of the radial nerve will result in loss of sensation in the radial disruption, and the risk of deformity surgical management is indicated. If we talk about the investigations are anterior posterior, that means AP, and lateral plain film radiographs of the humerus are usually that in all require. The elbow and shoulder should be visible. In severely comminuted class cases, CT is required. Management. So, what are the treatments of this fracture? The treatment may include the management is a realignment of the limb, and the majority of the humerus shaft fracture can be treated conservatively in a functional humeral brace in most fractures of the diaphysis. This should be with the humeral brace. Fractures that are less than 20-degree anterior angulation, 30-degree varus or valgus angulation, and within 23 centimeter of shortening are typically deemed suitable for conservative management. Requiring regular follow-up with repeated plain film imaging, around 90% of patients will go on to the full ununion within 8 to 12 weeks. For very distal fracture, a humeral brace will act as a fulcrum and may exaggerate the deformity. Therefore, a high above elbow cast should be applied. If we talk about the surgical management, surgical fixation is needed in the minority of the patient and will typically involve open reduction and internal fixation with a plate. This permits return to work slightly quicker than a conservative management. Intramedullary nailing may be indicated in the presence of pathological fractures, polytrauma, or severely osteoporotic bones. Complications are, in the most cases, the prognosis is good, with minimal impact or function once the fracture has healed. Non-union and malunion are important, albeit fortunately rare complication to consider in humeral shaft fracture. Valgus angulation is slightly more common with transverse fracture, however, rarely causes functional limitations, as the shoulder has such a vast range of motion that most deformity in the humerus can be accommodated for. So, if we talk about the main points all about the shaft of humerus are the majority of humeral shaft fracture affect in middle third of the humerus. They can be diagnosed in plain film radiograph with lateral and anterior posterior views. Most cases can be treated conservatively. Damage to the radial nerve should be assessed for all the cases. So this was all about the fracture of shaft of humerus. Hope you understand it well. If you have any queries related to this video, ask me in comment section. I will solve this. This video is powered by Jyoti Vidyapeeth Women's University Digital Version 2.0. Namaste. Khush rahiye.